You're welcome to the Reproductive Health segment with Dr. Ajayi, and my name is Dr. Abayomi Ajayi. Last week we started special conditions that affect fertility. We talked about uterine fibroids, and I must thank you for all the responses that we were able to get from that program. We're continuing in that light today, and we are discussing a very special topic today, polycystic ovarian syndrome. It's a big name, but we have, because it's a special topic, we also have a special doctor to discuss it. So Dr. Kolade is there in the house today. Dr. Kolade, welcome to the program.
Thank you very much.
Yes, I was just saying that we have something very interesting to talk about today, polycystic ovarian syndrome.
Well, yes.
What is this all about?
Polycystic ovarian syndrome is a condition in which the ovaries of a woman has multiple cysts. Cysts can be regarded as bags that contain water. Contains multiple bags that contain water. That's a major characteristic. Other things are that women that have this condition, they tend to have irregular periods. So if you say a woman that has periods 6 times in a year, 4 times in a year, a woman in reproductive age, she most likely has polycystic ovarian syndrome.
Okay.
Yes.
So in other words, you said that this is not an uncommon thing.
It is not an uncommon thing.
Okay. And if I can piece from what you said again, maybe it's putting the cart before the horse. Okay, maybe I'll take it one at a time. How do you diagnose this condition?
Well, making a diagnosis of this condition, well, first, of course, the person has to come and say, oh, she has a regular period. Mm-hmm. Or some people will come and say they have excessive hair on their face or excessive hair on their bodies.
What is that? Excessive hair?
Excessive hair on the face.
Yeah,
so
like what?
A woman that you have that gets to shave.
Good, okay.
Something like that, that gets to shave. Maybe the face or the chest or the arms. That could also be a pointer to polycystic ovarian syndrome. Okay. So that will give us an idea to that. Okay. And apart from that, an ultrasound scan will show these characteristic cysts within the ovaries. Mm. Yes, we'll now put this together with a blood test that we like to do. So a blood test will tend to show that the male hormones, testosterone, are higher than you would have expected in a woman. Okay. So putting this together, it shows that this person has polycystic ovarian syndrome.
Very good. That's the question I really wanted to ask, that I said I shouldn't put the cart before the horse. So from what you're saying now, is seeing many cysts, like you said,
yes,
on this ultrasound scanner, is it enough to make a diagnosis?
No, it's not, certainly not enough to make a diagnosis.
Okay, so you need to put some other things together with, because those are some of the things we get. We see appearance, polycystic appearance of the ovaries, and people say, oh, polycystic ovarian syndrome. So what you're telling us is that it might not necessarily be.
Yes.
Okay.
Yes.
Now, how do you treat this condition?
Treatment of polycystic ovarian syndrome will depend on what the person desires, for instance. A young woman who has irregular periods and that's her complaint, then give her something to regularize her period. Because like you probably know, you see, people believe that if you don't see your period regularly, maybe you'll get ill, maybe it's bad blood that is hiding somewhere, that kind of a thing. So you give her something to make her periods come regularly. Okay? For the woman whose hair is excessive, maybe on the face or on the body, and she doesn't like it, you give her something to correct that. But the most pressing problem our people have with this complaint is inability to conceive.
Okay.
And that's basically because people that have polycystic ovarian syndrome, they don't ovulate regularly. They don't release egg regularly. So that tends to translate to inability to conceive. Yes.
So, okay. So there's a bearing to infertility.
Oh, definitely.
Okay. Now, how do you treat this? What is the cause of infertility in polycystic ovarian? You said it in another word, that they don't ovulate regularly.
Yes.
Okay.
That is the cause, actually. They don't have regular ovulations. Of course, that's why it means that's why they don't get to see their periods regularly.
Good.
Yes.
Okay. How do you treat this condition? You told us about treating the symptoms.
Yes.
If the too much hair on the face, you can do a few things.
For that, some other things.
Okay.
Yes.
Now, with infertility.
Yes. Yes. Well, of course, it may not be enough to assume that is the only problem.
Okay.
It would be wise to see her partner, be sure there are no other problems with him.
Okay.
Okay. Then we
like
now,
what? Like what other problem?
Like we can look at we have to look at the sperm, for instance,
all right,
to be sure that the parameters are optimal. So for the sperms, if the parameters of the sperms are optimal, and for instance the woman, the fallopian tubes are open, then we can say, oh, okay, maybe it's only this irregular ovulation that is a problem. Then we can give drugs to address that and watch for some time. Because truth of the matter is that the woman can still be ovulating regularly and still not conceive. So we can give a shot of that, maybe 3 to 6 months, and see if conception occurs. We can give some drugs to try that. And well, if the drug does not work, there's actually a surgical procedure that can be done. Yes. We call it ovarian drilling, in which multiple punctures are made in the ovaries so that can drain this cyst of the fluid they contain. And many times people have regular periods from this, and begins to ovulate regularly. Ultimately, if this doesn't work, then we will have to get to in vitro fertilization.
Oh, okay.
Yes.
So, because of polycystic ovaries, we might have to do in vitro fertilization.
Oh, well, yes,
sometimes.
we might have to.
Okay, because the woman is not releasing the egg, and without the release of egg, there is nothing for the sperm to
mate with.
Okay. Now, apart from this, is there any other consequence of this, or possible consequence of this polycystic ovarian disease?
Yes, polycystic ovarian, it has some medical implications actually. Yes, people that have polycystic ovarian disease, because of the irregular menstruation, they tend to store estrogen in the body, and this tends to predispose them to some endometrial diseases. Endometrial hyperplasia, even some cancers. They tend to produce endometrial cancer also. Then we also notice that people that have this disease, many of them tend to have hypertension, and some of them tend to develop diabetes. So we're not even looking at polycystic ovarian disease. It's not just a fertility thing. It might even become a chronic medical thing with other things being involved, like hypertension, diabetes, endometrial diseases.
Oh, good.
Yeah.
Now, I was going to say this. I mean, from what you're saying, what can it be linked also to obesity?
Obesity, yes. In actual fact, something I should have said earlier was that a lot of people that have polycystic ovaries actually are able to get pregnant by their own. Yes. But then some people are not able to because they don't have ovulation regularly. But then, so when you have someone that has polycystic ovaries, she may be having regular periods. When she begins to gain weight or become obese, then her periods become irregular, because that also has a major implication in the whole disease process. So when there's obesity involved, in fact, in encouraging these people to lose weight could also aid in making her have regular ovulations. Obesity also has implications, yes, where PCOS is concerned.
Good. So we've looked at, now maybe what we should probably, about to summarize on this, if a woman, if there is a finding of polycystic ovaries on ultrasound, what steps should the woman take?
Well, it will be good for the woman to see a specialist, yes, because it will be good for the woman to see a specialist. Then the woman will have to have a blood test done, that her hormones will be looked at. Follicle-stimulating hormone, luteinizing hormone, testosterone, prolactin, because these things, they have abnormal values in people that have this disease. And of course, we have to evaluate her husband to be sure where we're going.
So, if we find polycystic ovarian disease now, the first thing is that you should not get worked up because of it. Because I've seen so many people with diagnosis.
Polycystic ovarian disease.
And they, as if the whole world is coming out. You heard it from Dr. Kolade. You don't need to get worked up. What you need to do is get more information about this, because it might be nothing. It might just be a coincidental finding.
Well, yes.
Yes.
Okay. As I said, up to 75% of people that have polycystic ovaries, they're able to get pregnant spontaneously.
Wonderful. Yes. Wonderful. So, I think it's on this very bright note we are going to end today's topic. We've just discussed polycystic ovarian disease. You know what next to do. If there's any part of it that you're not very clear about, you can always give us a text message or write a mail to us, and definitely we'll be willing to answer you. So it's on this note that we'll draw the curtains for this week's program. See you next week. Thank you very much.